Well, at the University of Connecticut, we have 100 students per class, and we have 9 rotations that they're required to complete during the course of their final year, their P4 year, fourth professional year. And so 100 times 9 is 900 rotations. Of those rotations, 4 are required, and that's in community practice, ambulatory care practice, internal medicine or general medicine, and institutional pharmacy. And then the other remaining rotations are elective rotations, 2 of which need to be direct patient care, and the other 3 can be either direct patient care or an elective in a non-direct patient care type of a setting. Interprofessional education is a hot topic in pharmacy education now and in healthcare in general. And it's not just isolated to the profession of pharmacy, it's all health professions. We all know that the team approach to patient care results in the best outcomes for the patient. And so it's integral and imperative of our programs to allow our students to experience working with other healthcare professionals so that they can perform at a better level when they get to a point when they graduate from our programs and actually go into a practice setting. We determine which practice sites provide interprofessional opportunities by doing an initial assessment when we first engage with those sites. We have field coordinators who actually visit the sites, interview the preceptors and some of the employees of those sites, and do an overall assessment of the sites to see if it provides the type of experiences that we are looking for our students. Recruitment of rotation sites is always a challenge, and given a lot of the changes that are occurring within the healthcare systems and healthcare in general, it is becoming more competitive to get the type of rotation sites that we would like. And so consequently, it is an area of more focus that we have. But again, at the same token, when you have a lot of changes that are occurring within the healthcare systems, that also brings up new opportunities in different practice settings that didn't exist 1-2 years ago. So there are new opportunities that are now popping up for our students. So as long as we're able to adapt to those changes, make modifications within our curriculum, and allow our students to have these experiences in a certain way, there's actually more opportunities in certain areas. The selection process for our students to get their, in particular their P4 advanced pharmacy practice experiences, starts early on in their third professional year. The students, we prep them for, number one, the diversity of the type of rotations that are available to them, and try to educate them regarding taking advantage of a lot of opportunities that we do offer them for rotation sites. By educating them and providing them with background information on what's expected, the objectives of the rotations, and then getting to the point where then we talk about the actual system of how they make their selections, and that's where core RX preceptor comes into play, educating them as to how the system works regarding the selection process and how they can increase their chances or odds of getting the type of rotation that they would like. Obviously, in a perfect world, we'd love to have them get all the rotations that they want and in the order that they'd like. But unfortunately, we don't live in a perfect world, so they have to have some sort of give and take in that whole process. But I think they could be successful in their selections provided that they understand how the system works and they make the best selections during the course of that process where we open it up for them. While students are in the field, we do track the type of activities that they're experiencing on rotations. Some of the rationale for that is our accrediting body, ACPE, does require our students to have specific types of experiences before and to be competent in these areas before they are practice ready. And so therefore, our ex-preceptor or part of CORE allows us the opportunity to track those type of experiences and to keep a record of it so that we can prove that they've demonstrated competency in those specific areas.